I'm Dr. Gitasree Mukherji, speaking from the Bhagirathi Hospital. Today I'm going to talk on a very important subject, the menopause. The menopause is a time in a woman's life when she stops getting her period for at least 12 months. The eggs are depleted between puberty and menopause, and then the hormones estrogen and progesterone are no longer secreted. So this leads to all the effects of the menopause. Why is it important? Firstly, every woman has to go through menopause, and yet it's hardly discussed. And secondly, menopause has multiple side effects. Some of them are short-term but can be quite distressing, and the others are long-term and can lead to chronic and sometimes severe problems. The normal age of menopause is between 45 and 55. It's usually a slow process, and the years before the menopause is called the pre-menopause. Sometimes it can be acute and very early also. Now, what are the side effects of the menopause? The first problem that a woman faces is that her periods start getting irregular, short, long, heavy, or light. She might start getting hot flushes where she suddenly feels hot even in a cold environment. She feels restless, gets palpitations and sweats. This can also happen at night, and she wakes up tired and unable to function normally. Brain function is affected. She might feel depressed, anxious, lose concentration, have lapses of memory. Genitourinary system is affected. She might be unable to hold her bladder, go more frequently. Sometimes she is more prone to bladder infections. Vaginal dryness happens due to loss of lubrication and lack of libido, and this leads to uncomfortable or even painful sex. Many of these problems continue for many years. Besides these, the long-term effects are on the cardiovascular system and on the bone. Estrogen protects the woman's heart, and after the menopause, she is more likely to get heart attacks and cerebral strokes. The bone problem is called osteoporosis. The estrogen also protects the bone, increases its mass and its power, and once the estrogen is lost, there's rapid deterioration in the strength of the bone, and it becomes more prone to breaks, even with minimal trauma. The usual fractures occur in the wrist, the hip, or the spine. This can lead to chronic pain. The woman might lose height, her back might become humped. Sometimes she's unable to function normally, loses her ability to carry on normal activities, and even may become bedridden, and this can even lead to death. So what can one do to deal with menopause? There's a lot a woman can do herself. She should eat a healthy diet, which contains calcium-containing foods like yogurt, milk, and leafy green vegetables. Exercise is very important, especially weight-bearing exercises like running, brisk walking, dancing, and resistant exercises like lifting weights. For the brain problem, she should try and get at least 8 hours of sleep, reduce stress in her life, maybe do yoga, meditation, contact friends, family, or even talk to her doctor. For the vaginal dryness, her doctor might prescribe lubricating gels and sometimes hormone replacement gels. For the hot flushes, there's a lot she can do herself, wearing light clothing, taking cool showers, avoiding hot and spicy foods. Otherwise, she should contact her doctor for hormonal treatment or for some non-hormonal treatments which are also available. Hormonal treatments may also be given for the bone problems and the brain problems. Sometimes it may be given for up to 5 years. But hormonal treatment should always be taken under the supervision of a doctor. The dose depends, and the duration also depends on the patient's symptoms, her risk factors, and what her doctor decides is best for her. For the cardiovascular problems, estrogens are no longer given. Normally she's given statins, blood thinners, and also referred to a specialist. For the bone problems, long-term hormone replacement help, and also other treatments like biphosphonates or SERMs. So menopause is an inevitable problem. Everybody has to face it. There's no getting away from it. But there's a lot a woman can do to help herself, and also multiple choices available for prevention and management of the chronic health problems. Thank you.